After 9 years of job experience, both nationally and internationally, I now established my own dental practice here in the center of Berlin in 2012. And as far as the design and the conception of my practice is concerned, I had 3 things in mind that really were very important to me. First of all, I have a relatively small practice. The space is limited, but although the space was limited, I never wanted any compromise concerning the safety of my patients or the implementation of my workflow concept. Second of all, we have very many standards and laws here in Germany that have to be observed, especially for practices that are newly built. And these standards mostly concern safety, but not only safety of my patients, but also safety of my team and me. And the third of all, most important thing for me is, of course, my job satisfaction. I want to spend as much time as possible together with my patients in the treatment rooms. And that's why I wanted everything that has to do with instrument processing to be run automatically and as time-saving as possible, so that even my assistant can spend more time in the treatment room and we can take care of our patients. Immediately after the treatment, used instruments are taken into the sterilization room. They can be stored temporarily on the unsterile side. In the meantime, we can take care of the patient in the other room. Instruments with cement, alginate and water-repellent bonding must be pre-processed. All the other instruments are placed in the washer disinfector without any kind of pre-processing. Our MELAtherm offers much space inside and short operation times. Particularly important is the active drying. Instruments can be removed dry. This protects instruments from corrosion and especially from recontamination. Instruments for conservation treatments can be reused immediately if they were cleaned and disinfected in a washer disinfector. They are immediately usable on place. With these instruments, we prepare standardized trays, which are used for each conservation treatment. This saves time and ensures the quality of treatment. Handpieces must be lubricated after the cleaning and disinfection process. After disinfection, surgical instruments are going to be sterilized. Sterile packaging is necessary to avoid recontamination during storage. The MELAseal unit is an important part in the infection control procedure. Our handpieces and turbines are being reused as quick as possible. We are using the quick handpiece sterilizer MELAquick 12. The cycle time is only about 7 minutes. This allows us to guarantee sterilized handpieces for each patient. All the other instruments are being sterilized in the vacuum sterilizer Vacuklav 31B. This Class B autoclave has short cycle times, is very reliable and easy to use. After sterilization, instruments can be removed from the autoclave. The vacuum system provides a safe drying. Packed instruments can be stored for up to 6 months. The sterilized handpieces can be used again immediately. From previous experiences in larger hospitals and smaller practices, I have relied on Melag, and I'm really happy that everything is working so smoothly. I, of course, appreciate Melag's design because this contributes to an attractive work environment, and that's probably important to everyone. With help of MELAtherm and the other Melag units, we really can feel safe about the hygiene and work very efficiently, and that's what makes the difference.